Hello, my name is Ece Tuncer and I will present my dissertation project today as a poster. There are many hypotheses and theories behind the psychosoma interaction in the literature. Many thinkers, researchers, and clinicians try to understand what is going on in our body and inside our mind. Plus, skin has an important place in psychology, especially in psychoanalytic literature. In this research, we compared individuals with and without psoriasis in terms of separation, individuation, defense mechanisms, and perceived rejection of the mother. Psoriasis is a chronic inflammatory skin disease with psychosomatic aspects and complex etiology that includes the immune system, genetic factors, and external internal triggers. It is the most common skin disease associated with psychological disorders with a rate from 40 to 90%. Maternal rejection is a broad term that reflects absence of maternal function, such as being responsive to the child's physical and psychological needs, soothing, containing, and regulating emotions of the child that predicts many physical and psychological health problems. Concepts of separation individuation is based on Mahler's theory that humans do not have a biological and a psychological birth at the same time, and a baby goes through various stages in the process up to the time of psychological birth. For psychological birth, the baby should separate from the object, means that develop a different and separate self-representation from its mother, and then become individuated, means that forming a unique and continuous sense of self. Defenses are the mechanisms used by the ego to keep emotions and conflicts that are difficult to accept at the conscious level away from conscious awareness through certain channels. The level of defenses from primitive to healthy may reflect the level of personality functioning, the fixated developmental period, and facilitate our understanding about the psychopathological diagnosis. In the literature, all of these three variables are found to be correlated. There have been consensus in previous studies that the mother's inability to contain and hold the baby in the early period and the sudden rupture of the relationship with the mother may affect the separation individuation process and cause various problems on the skin. Also, since separation individuation difficulties may lead to use of primitive defenses predominantly, the usage of primitive defenses may lead to project primitive aggression to the body. The aim of this study to compare individuals with and without psoriasis in terms of separation individuation, defense mechanisms, and perceived rejection of the mother. It is hypothesized that individuals with psoriasis have more perceived maternal rejection, more separation individuation difficulties, and use more immature defense mechanisms than individuals without psoriasis. The research was conducted in accordance with the survey model and was designed according to the experimental design with experimental and control groups. The population of the study consists of psoriasis patients and individuals who do not have a skin disease. A total of 175 people participated in the study, in which 91 patients with psoriasis and 84 individuals without skin disease participated. Demographic information form, adult acceptance rejection scale short form, defense style questionnaires, and separation individuation inventory were used as a data collection tools. The analysis of the obtained findings was made using the SPSS 25.0 program. When the mean PARC scores were examined, it was found that individuals with psoriasis perceived their mother as more rejecting than individuals without psoriasis. When the mean SSI scores were compared, it was found that individuals with psoriasis had significantly more separation individuation difficulties than individuals without the disease. In addition, individuals with a total score above 190 were considered as pathological according to the questionnaire, and the groups were compared based on this cutoff point. While 44% of psoriasis patients had pathological separation individuation difficulties, this rate was 14.3 in the control group, which was significant. When the mean scores of the three levels of DCQ, which are divided into mature, neurotic, and immature defenses, were compared and significant differences were found in the mature and immature defenses. Sample with psoriasis use immature defenses more and use mature defenses less than those without psoriasis, and this differences was found to be statistically significant. In conclusion, Our findings suggest that individuals with psoriasis perceive their mothers as more rejecting compared to individuals without psoriasis. In the literature, many psychoanalytical theories and findings supported this finding. Winnicott suggests that the caregiver has an importance for the baby's mind-body integration. According to him, skin disease occur as a result of the inadequacy of the mother's containment function, when the integration between the psyche and the body does not yet exist. One of the potential explanations might be is that psoriasis is affected by psychosocial factors occur with an impaired self-development, disruption of the hypothalamic pituitary adrenal HPA axis, and cortisol and neuropeptide levels due to early traumas. According to Mucci, stress-induced bodily disease occur as a result of a persistent chronic emotional distress that hits already predisposed target organs. The disorder becomes permanent as a result of chronic emotional dysregulation in early object relations and emotional dysregulation caused by the reenactment of the relationship in other relationships. It is well accepted that the quality of the intersubjective relationship with the early caregiver and relational traumas are the main causes of separation individuation difficulties and emotion dysregulation. According to Mucci, a healthy self-development of the infant depends on the internalization of maternal functions by a caregiver who can adequately perform the function of regulating emotion in order for child to develop emotion regulation and symbolization abilities. If the mother does not perform this function, the child cannot find himself in the mother's mind, so that the self cannot form an integrated identity, cannot feel a sense of security, since he or she cannot develop a self-representation. Also, linguistic expressions, abstract thinking, and verbal expression cannot develop, so that emotions are expressed through bodily disease as a result of inability of verbal expression and symbolize emotions. When we compared groups in terms of separation individuation, it was found that individuals with psoriasis had significantly more separation individuation difficulties than individuals without the disease. Also, pathological separation individuation was significantly higher in the psoriatic patients. There are many theories on the importance of the skin, which is a boundary between self, object, and the external world. As Douglas suggested, the characteristic fears in the separation individuation process, such as fear of engulfment, abandonment, or fusion, might be reenacted in adult life, and the physical disease may serve as a protection of the body borders from the anxieties of separation individuation process. Also, the disease might gain continuity since the separation individuation anxieties may trigger the HPA axis activation, which then increases the probability of exacerbation. When the groups were compared in terms of defense styles, it was found that individuals with psoriasis use significantly less mature defense mechanisms and use more immature defenses than individuals without the disease. Clin in Annals suggested that some bodily disease occur when unprocessed and raw emotions are reflected on the skin and become a means of expression. Especially immature defenses such as projection might be used to turn aggressive drives into themselves. Psoriasis patient might have intense and unsymbolized aggressive drives, fail to balance these impulses with mature defenses, and predominantly use primitive defenses that direct the aggressive drives to the body. Lastly, skin disruptions may be a way of communicating disruptions in early object relations, self-functions, self-boundaries, and self-formation. When we put together all these findings, since separation individuation difficulties, disrupted object relations, and use of primitive defenses might be related to identity diffusion and more primitive psychic structure, we might say that psoriasis patients might function at a more primitive level of psychic and or personality structure. However, to understand these phenomena deeply, more empirical studies should be done. For future research and clinical implications, we suggest that interdisciplinary teamwork should be done in both research and practice. Psychodevelopmental factors should be considered. Therapy methods should be developed based on the findings, and therapists should be trained based on the research findings. Thank you for listening.